We still don't have reliable cures, sadly, for many forms of cancer, which I know is a huge interest of yours. And despite the huge amount of time and effort that's been spent, how much do you think this reflects a lack of basic knowledge still about the underlying mechanisms and interactions to make druggable targets accessible for new therapeutics? Is it still a lack of basic knowledge, or is there some other major problem that's preventing progress in clinical therapy?
Yeah, cancer is such a large collection of different diseases, and I think, you know, for some the basic knowledge is probably, and we know it, that there are some cures based on tyrosine kinase inhibitors, on research in the lab, and it has led to very important advances in cures. But then there are other types of cancer that are evolving so fast, continuously mutating, and it's sort of a moving target. And so you develop one line of therapy. I mean, that's at least my impression. Let's say a novel treatment based on a compound, but then in relatively short time you will find new variants that escape. It's a little bit like with COVID now.
Exactly. I was just thinking maybe as we find some of our colleagues unable to attend today because of yet another wave of new COVID variants that are infecting, is this just simply unavoidable with viral infections?
Well, I mean, COVID, I think, is a very unique virus. I mean, I don't think we have seen anything like it before. And I mean, if you want to talk about COVID, from a virus point of view, when I saw the news coming out of China that this virus has a latency period in which it is already infectious but causes no symptoms, I became extremely worried that this could be terrible for you know, as a pandemic. And I've actually alarmed people in our director, you know, we should think about how to react in the institute at that level. At that time, they thought I was a little bit overreacting, but this is of course a terrible situation. You know, with flu, you're basically only infectious when you have the symptoms already, and so it's very hard to do anything about virus spreading. And of course, there is no. I don't think there is a strategy right now that people think agree on that is the best one. And this is a little bit like with cancer. That we are learning a huge amount, and we are coming out with all kinds of therapies. I'm sure that actually eventually we will be able to have the capacity to treat most forms of cancer with highly specialized, you know, personalized treatments like which are being developed by the people who developed the BioNTech vaccine.
So our personalized medicine, precision approach.
So they're basically charting all mutants in the tumors and then targeting with a specific RNA